Hi, so I'm back. My name is Lauren Collins. I'm a physical therapist and I specialize in pelvic physical therapy. So I decided to change the topic I was going to talk about today and talk about tampon insertion instead. I have a daughter, and of course, being a woman, I can understand how it is to try and do that for the first time or try and do it if it's difficult or painful. So we're going to talk a little bit about that, okay? I know the last time we talked about anatomy, or a previous time we talked about vulvovaginal anatomy and pelvic floor muscles. Today I want to talk a little bit about just the orientation of the vagina and uterus and the organs, right? More of my artwork. Here we go. So this image is as if someone is facing to the right, the woman's facing to the right. So up front you have the pubic bone. Behind the pubic bone you have the bladder and the urethra. Behind that you have the uterus and the vagina, and behind that you have the rectum. And then towards the very back, of course, is your sacrum here, and then your tailbone or coccyx here. And the pink at the bottom, these are our pelvic floor muscles. So the significance of this is, if you notice, the vagina is slanted, okay? So if we take a tampon and we insert it, if we're going straight up, ouch, we're gonna like hit bladder and just something's not gonna be really comfortable. So you have to slant the tampon when you're inserting it towards the back. So to go into this a little more in depth for you, I'm going to pull out some other things. Ta-da! This is a vulva, and it's a vulva that a patient made for me. Thank you so much. It's great. I love it. It is an awesome teaching tool. Here is the prepuce, here, which is the hood of the clitoris. Here's the clitoris. Here are the labia majorum. Here are the labia minora. So inside, this is where the vaginal opening would be, okay? So if someone's standing, which means that our perineum or our vulva is now facing the floor and your legs are on either side, here's a tampon. When you go to insert the tampon, you want to insert into the vaginal opening, and then you want to head back and up this way, right? So we're inserting the tampon and you're heading towards the back. You do not want to go straight up like this. That's going to be uncomfortable. You want to insert it and head towards the back, okay? So again, to kind of describe what I'm talking about here, I'm going to show you another example. I have here a pillow with an image of the vulva and the vagina from what we did the last time. So if I back up, maybe you can see it. You can see a little bit better there. Right. So if you're inserting a tampon, you'll be standing. Right here is the vaginal opening here where I have a little cutout. I'm going to take the tampon again. You're going to take the tampon, you're going to insert it, and you're going to angle it back. Okay? So if I'm facing this way, we're inserting the tampon, and we're inserting it back that way to insert a tampon. So the other thing about this is that when you insert a tampon, if your flow is not heavy on that day, it's going to be dry, okay? And if it is dry, you can just get a little bit of lubricant, the kind I like to use, and I suggest for my patients, recommend for my patients. Can you see that? It's called Slippery Stuff. And Slippery Stuff is a water-based lubricant. It does not have parabens in it. It also does not have in it something called propylene glycol, which is an irritant for a lot of people who have vulvovaginal pain. So you can check the labels on the lubricant that you use and see if that is something that would be a concern for you. You can order it on Amazon if you would like. You just take the lubricant, you'll rub it on the applicator and insert the tampon. Once the tampon's inserted, you just simply press the plunger as far as you can comfortably, right? And then you pull out the plastic. The cotton part stays in with the string hanging out of the vaginal opening so you can remove it. The other part I want to say about tampon usage is that you want to use a tampon that goes with how your cycle is flowing. Do not use a super tampon if you're flowing really light for the day. That is going to make it uncomfortable to remove when you do take it out. So the lighter you're flowing, use a light tampon. If you're flowing heavier, then go ahead and use the super. If it's kind of medium, go ahead and use the regular. So those are just some tips for tampon insertion. Also, I know that it says, I believe on the package, don't quote me if I'm wrong, read the package instructions on how long you should keep a tampon in. I don't usually recommend keeping it in more than what the recommendations on the package are, or I wouldn't ever recommend keeping it in longer than that. And if you're flowing heavy, be careful because it can get soaked and the blood can seep through. So you want to be careful of that as well. So I think that is it for our lesson today. If you have any questions, please feel free to leave them in the comment box below, or any comments, leave them in the box below, or suggestions, please let me know. My website is www.vitalselfpt.com, and join me again next time. I look forward to talking to all of you. Have a wonderful, wonderful, blessed day.